Treatment Protocol E. Reservoirs and complementary pairs. We saw earlier that reservoirs are places where microorganisms hide indefinitely without producing any symptoms. The microorganisms hidden in a reservoir can leave it at any time for unknown reasons, or because that reservoir pair is impacted or balanced with two magnets. When they leave their reservoir, these microorganisms will go to their natural location in the body, that is, to their corresponding biomagnetic pair or biomagnetic pairs. These biomagnetic pairs that correspond to a given reservoir could be inactive and perfectly balanced before the reservoir was broken. But when the reservoir is destroyed, these corresponding pairs will surely be activated, and therefore they will have to be corrected in turn. If the therapist balances the specific reservoir of a particular microorganism, then he will have to balance the pair or the pairs that are characteristic of this microorganism. If the therapist deactivates a reservoir of viruses in general, these viruses will come out to their own pair or pairs. But the therapist cannot know a priori which specific virus was hiding in that reservoir. Therefore, he needs to scan and check one by one all the existing pairs corresponding to viruses. Thus, he will find out what virus or viruses may have been activated when the reservoir was broken. And once these altered pairs have been discovered, the therapist will have to balance them immediately. The same applies to bacteria reservoirs, fungi reservoirs, and parasites reservoirs. Similarly, and even more generally speaking, if the therapist breaks a universal reservoir, he will have to scan and verify all existing pairs one by one, viruses pairs, as well as bacteria, fungi, and parasites pairs. Once he discovers which pairs may have been activated, the therapist will then proceed to rebalance them. Therefore, it is advisable that the therapist begins the complete scanning of the patient by checking in the first place the universal reservoirs and the general reservoirs, that is, the reservoirs of viruses, bacteria, fungi, and parasites. Once it has been checked that none was active or none is still active, then all the other points and pairs of the list should be checked. But if the therapist does the opposite and finds out and breaks a universal reservoir near the end of a therapy session, then he would need to restart again to check all the pairs one by one from the very beginning. Since a universal reservoir has been destroyed, any pair might have been activated, even though that pair had previously marked as being balanced. And this would be a waste of time for both the therapist and patient. However, specific reservoirs need not be scanned at the beginning of the session. If any specific reservoir comes out active, this would not require to check all pairs from the start, but only the pair that corresponds to the microorganism that was hiding in that specific reservoir. Once the therapist has finished scanning the universal and general reservoirs, and then all the other existing pairs, he will balance all the pairs that were altered. Complementary pairs are those that correspond to the same microorganism. There are some microorganisms that can correspond to more than one biomagnetic pair in the body, because their genetic code so dictates. Some microorganisms, such as Proteus mirabilis bacterium, may be located in 5 different pairs. This pathogen will give a different symptomatology if it is located in a pair or another, although it can also share some of the symptoms in all of its various locations. As in the case of reservoirs, a microorganism having complementary pairs may flee to them if its pair is balanced and it feels threatened. Complementary pairs are not reservoirs because reservoirs do not produce symptoms. The microorganism is only latent while hiding in the reservoir. However, if a therapist balances a pair that has complementary pairs, he should also put magnets simultaneously in its complementary pairs, even if they are not active. Thus, we will be closing all the loopholes that this microorganism has to go to seek shelter elsewhere. We re-emphasize that if the therapist balances with a couple of magnets a pair that was previously altered, he must take care of all its potential reservoirs and complementary pairs as well. This is the reason why a therapist should have at least 15 pairs of magnets at his disposal. At the same time, strict adherence to this methodology will give the maximum guarantee of treatment success, which is the main goal.